السلام عليكم ورحمة الله وبركاته. احنا في شهر جانوري هو شهر توعية بسرطان الرحم، وتواكبا معه احنا حبينا نكون هني في محاضرة توعوية بالتعاون مع مستشفى الشرق الأوسط للسرطان الرحم. فدكتور شريستا أخصائية نساء وولادة وأخصائية نساء تجميلية، إن شاء الله بتحاضرنا هي عن سرطان الرحم والأسباب والاحتياطات والبريكوشن اللي أنتم لازم. Just I was telling this is the month of the cervical cancer awareness. So Dr. Shaista, she is from Middle East. She is a consultant of gynecology, and she will present it for us the lectures about the cervical cancer.
Cervical cancer awareness is, this is very important topic and it's very, very sensitive topic, okay? So you have to understand where exactly the cervix is looking and why the cervical cancer is happening. So the cervix means the uterus, the raham, okay, and down is the hod, the vaginal area, okay? Above is the uterus and down is the vagina. In between this area we call the cervix, okay? Anka raham, okay? So this is the more common when we see the cervical cancer. What happened in this area, this we call the excessive number of the abnormal cell is collection coming in this area, so we call the cancer. So mostly the main thing we have to know what is the risk factors, why is happening, what's the prevention of the cervical cancer, and which person can most affect, and what was the reason the cervical cancer is happening. The cervical cancer means mostly is not depend on which age of the woman or which age. No, this can happen any sexual active woman. If there is for example, if many women they are married and they don't know about the pap smear, they don't know about the screening test of the cervix. So this is the difficult thing, and they don't have awareness about this. Even after the delivery, when we ask the patient, please do the pap smear, they don't know what's exactly the meaning of the pap smear, what we are going to do. So we said the HPV this is the main common reason when the patient they can get the cervical cancer. Why the HPV? This is we call a human papilloma virus. The human papilloma virus, they have more than 100 type of the virus, and this virus is coming like from any lifestyle. Maybe the patient they have a family history with the cervical cancer, and they don't know about that time with the mother or auntie or someone else they have HPV positive. Because these days when we ask about the HPV, this will be the more practical. We have to explain the patients about the HPV like human papilloma virus. The human papilloma virus, they have more than 100 types of the virus. Then can be affect the woman in the different sexual partners. How many women they have not only one partner, they have multiple partners, either male or female. So cervical cancer is not only the HPV can make the cervical cancer, but the HPV can happen if there is positive someone, so it can be effect in the cervix, in the vagina, in the vulvar area for the female area, and then in the anal area in the women's. In the men, the HPV, if they have a positive, unfortunately in Bahrain we don't have the male HPV test, but if they are positive, someone have a warts in the area of the penile area, they can have a positive with the HPV, and they can have a cancer in the future like anal area, penile area, and the throat area like in the neck, they can have a male and female both sides if they are HPV positive. So how many women when they do the pap smear only but they don't go for the HPV, so that means they have a chance. For example, if they do the pap smear and their changing is coming on the pap smear, that not mean 100% they have a cervical cancer. They have a type of the cervical cancer actually. Some cervical cancer is coming, okay. So as I said, for example, this is like a uterus, it look like, this is the ovaries, this is the tube, and this is the area of cervix. Down is the vagina, upper is the uterus, so this is the cervical area. So most commonly the abnormal cell increase in the number, so we call the cervical cancer. The cervical cancer can be often early, sometimes even prevented having the regular screening test. For example, if you are doing every 3 years the pap smear, definitely you will be in the safe side. And the cervical cancer is the main cancer in the women they have very easily treated if they are positive cervical cancer, yeah. So this is not like other cancer difficult to be diagnosed or something. Yes, if someone is ignoring herself, they are not going for the pap smear, or they don't do the HPV test, definitely in the future they have a chance. For example, they are positive HPV, they have abnormal cells is present in the area, they don't go for the pap smear, in the future they have a chance for the cancer. Continue. So as I said, there is a different kind of the cervical cancer. This is like a medical word, but you have to understand what type of the cervical cancer is happening in the cervix. So the squamous cell carcinoma, this is like 9 out of 10 women can be have. Not all the women, for example, if they have HPV positive, they have this cervical cancer. But this is like outer area, only like a, this is the cervix, like Ankorham, only in the skin area, not in the deep area, because deep area there is a big thick muscles are there. So for example, if the anterior part of the cervix, if they have a cervical cancer, this is we call squamous cell carcinoma. The more dangerous is the adenocarcinoma. That means the cervix is already infected, but in the middle part, because behind is uterus. If it's the middle part they are positive, they mostly they found like adenocarcinoma. And then the mix, like maybe anterior, posterior or middle area, we call adeno-squamous cell carcinoma. This is like a mixed carcinoma, that means all the cervix is involved already. So this is very rare, but most commonly when we see the patients is adenocarcinoma. So this is as we said, how the cervix is look like. That means the lower part is look like that. When we take the pap smear, we take the pap smear from this area. Okay. So mostly the cervix, the cervical cancer is happening. This is the main dangerous area. So when we take the swab and when we do further test, so we are not going too much deep in the raham. Okay, so we have to go only in the Ankorham, like only the anterior part. We take the swab test. The swab test we do with the HPV and pap smear in the same time, and the same sample we send for the patients. Change. So as I say, the HPV, like human papillomavirus, many women when they explain them with the patient, they don't know about the HPV. There are more than 100 types. Can you change the slide, then I will come back. So there are more than 100 types of the HPV. All the HPV positive, they don't do the cancer. Okay, maybe you have a history in the child. Sometimes they go to the school, they have a warts in the face, in the hand. They are different types. They are not like genital warts. They have like they don't have HPV, but they are different type of HPV viral warts. They don't do any cancer. They are just on the skin area, so they can go for the treatment like laser treatment. They can remove it, even in the skin, any part of the body. As I said, some kind of HPV they affect on the cervical area, genital warts. Maybe they mostly the 16 and 18 number they are positive in the females. This is we call high risk HPV positive. They are the one mostly common in the cervical area. This is the main cause of the cervical cancer. As I said, the problem like mostly if we see 6, 11, 16 and 18 is positive in the pap smear. Yeah, they are the high risk. So we have to see about the pap smear report. When we do the pap smear and HPV, if the pap smear is not normal and HPV also there is a positive and high risk, so we have to be take the second step after the further treatment options. Male, yes, they can be affected. Many women they come, they ask me, my husband have a warts in the penile area, so I click this one. I say, okay, you have to go for the not only the pap smear, you have to go for the HPV test as well, because we don't know if they are positive. As I said, in Bahrain, the male they don't have any HPV test. Only the women we can do with the pap smear in the cervix with the same together. So if they are positive, if any more men have they can be have in the body another part of the warts, but only the warts in the genital area, in the penile area or down. Yes, we have to do the female, the wife or female, the partner. They have to do the HPV test as well. So they can be affected in the penile, anal cancer, penile cancer, and throat cancer. Can be happen both male and woman. Why throat cancer? Because if the genital area, male or female, if they are positive with the HPV, so they can be have throat cancer because they do the anal sex or oral sex. So the oral sex who doing that, they have mostly the chance for the cancer in the neck. Yeah, so the previous one. Yeah. So as I say, the sexual history, this topic is very sensitive. When I say like any words, so be careful, because the things is, you know, sexually partners, any woman when they have more than one partner or the male they have more than one woman, yeah, they are most commonly they are positive with HPV. Why? Because when we say the skin to skin contact, yes, they can have a skin to skin contact. That means sexually skin contacts, multiple sexual partners, they have most probably 100%. I mean, they are HPV positive. Why? Because if someone already positive, they can bring to the man, or men can give to the woman, or woman already positive with someone else, they can give to the male. So this is like a skin to skin contact or a sexual activity. So that's why always we say advise the women or male when they have a sexually more than one or two partners, they have to go for the treatment option. I will later on I will discuss what was the treatment option. So if someone have a weakened immune system, many people, many women or many children, they have a weak immune system from her early age of the life. So they have to be regularly they have to go for this HPV test, or they can have a chance to be HPV positive. The chlamydia infection and gonorrhea, this will be the sexual transmitted disease we call STD. As I said, whoever more than one sexual partners, they have STD positive. So mostly the infection, most dangerous one, chlamydia infection and gonorrhea. So how many people, women or male, when they come to us and they ask us, I find this one in the STD test, I want to do for my partner as well. So when we see, definitely they are positive. So this is another chance to be HPV positive. Any woman when they are taking the long-term contraceptive like oral pills, like we can say that they are trying to stop the pregnancy, or maybe they are using some other kind of the hormone medicines. So if you are taking the hormone medicines, for example, more than 1 year, you have to do the screening test. Multiple full-term pregnancies, who have more than 4, 5, 6, 7 babies, yeah, they have to do the screening test regularly. They should not ignore. Young age, first full-term pregnancy is young age. Why they are asking? Because when they sexually active, they suddenly after the marriage they get pregnant. They didn't go for the pap smear, so definitely they have to go for the screening test as well. Economic status, that means someone is not affording to go for the pap smear. How many patients they come when we advise them, they say, doctor, the insurance is not covering, so we will not do it. We don't afford. So for the health, you have to take time and do because HPV in Bahrain is a little bit expensive. So mostly because this is a screening test, whatever screening test, many insurance they don't cover. So for example, if they have HPV, at least not covering, at least the insurance covering some insurance pap smear, you have to do the pap smear as well. Whoever not taking the healthy food, definitely this is all the time we are asking any cancer chances for the family or the health. Yeah, you have to go for the healthy options. Having family history of the cervical cancer, yes, you have to go for the family. If someone diagnosed already in early age, like they have uterus, the cancer in the uterus, cancer in the breast, or cancer in the cervix, they have to go for the screening test as well. Yeah. So this is very important slide. When we say the human papillomavirus, you have to understand what is the HPV. Please, when you have a time, do the Google and just check what is the HPV, okay? So then you understand what is the importance in the cervical cancer about the HPV. So as we said, this is already I discussed, like this is more than 100 types. When we see the HPV, for example, the pap smear is abnormal, changings is coming. Sometimes they said ascus, that means atypical squamous, the changings. Okay, this is like similar, like very small area in the cervix is changing, but in case if it's showing the high risk of the HPV, definitely we have to go for the further option of the treatment. So the warts look like this in the penile area, or I just show the hand, maybe in the hand, maybe in the body part, anywhere. It can be happen the multiple area in the warts. So you have to know what kind of the warts look like, and someone have a warts, maybe they have a HPV positive, but what type of the positive we don't know, can change. So symptom is very important to know. If women when they have a vaginal bleeding in between the periods, many women when complain they said I have a spotting, I have a period, again I have a spotting, that means it's intermenstrual bleeding. Or someone have a bleeding and then spotting, again the bleeding, this is not normal. So they have to know about this, but not all the bleeding they can do the cancer, but there are other things can happen. Heavy than normal of the menstrual, we are not talking about the heavy means the blood clots is coming out, this will be different things can be happen. Heavy means when we check the pad, it will be fully soaked. Okay, that means this is like heavy periods, or maybe the woman they change maybe more than 6 or 8 times of the pad per day, they have a chance. Pain during the intercourse, whoever sexually active, when they feel during the pain, normal we can say vaginism. This vaginism is different things, okay, but the pain during the intercourse, they complain bleeding after the intercourse, yeah, this is not normal. If someone have a sexual active, they said we have we do the intercourse and we have a spotting each intercourse, no, this is not normal, they have to be checked for the screening test. Pelvic pain and leg pain, this is very important. This will be like already the patient, they have cervical cancer already started, they have they feel all the time, I'm tired, I'm lethargic, I don't have energy, or I have a lower abdominal pain, or I have pain in the lower leg. Yeah, this is the things is very important to know. Vaginal discharge, why vaginal discharge is, see, all the vaginal discharge is not a cancer, okay. So when the women, they have HPV positive, they have a repeated vaginal discharge. How many times they go for the treatment, they don't treat it. They said again we have the vaginal discharge, so that's why they have to go for the screening test, at least do the HPV, so we have to know like someone have a positive or no. Many times when we complain the patient, they have said we have a discharge vaginal with the smell, and repeated every month we have the vaginal discharge. We go to the doctor, they give us like a treatment, but it's still not helping us. So that means we have to go for the further option, not only the vaginal swab, take it and khalas patient go, no. We have to go for the screening test. We have to ask the patient, when you take the last pap smear, if she's saying I didn't take it like more than 5-6 years, no, yet they have to go for the pap smear and HPV together. Vaginal bleeding after menopause. Menopause means they completely stop the bleeding. If whoever already crossing the menopause and they didn't do any pap smear, they have to go for the pap smear at least once. But if they know, if they start the spotting brownish or red, they have to go for the pap smear. Yeah. So how to prevent the cervical cancer? This is very important slide. We have to understand the HPV vaccine is very important. The HPV vaccine is treatment only for the HPV, okay, it's not treatment for the cancer. But the cancer treatment will be different. This is only preventing the HPV to not to get the cancer in the future. So the HPV and the second thing is a screening test. As we said, the pap smear and HPV we have to do together. How the pap smear is look like, I will just show you the picture. It's not difficult. How many you are married? So you do the pap smear? Not yet. Oh, you run away. This is actually, when we talk to the patient, they said we are scared about this. No, this is not a scare. This is your life. This is not like delivery pain or something. This is like a normal examination, but they feel like uncomfortableness, yeah, and this is not like painful. So if they see, for example, the HPV test look like is every 3 years you have to do the pap smear, yeah, and the HPV we do every 5 years. But if someone already have a history in the family, or they have a history of the warts, yes, we have to be repeat. If they have a positive HPV, they have to be do like every yearly until it come negative. The more things we have to talk about, whoever have a chain smoker or smoker, they have to stop the smoking, because the smoking is another cause. As in the beginning when I said is a squamous cell carcinoma, so they can be happen in the squamous cell carcinoma because of the cervical the smoking. The condom is very important. Whoever sexually active and they have already positive, the wife and the husband is normal, so they use the condom to prevent the HPV from one person to other person as well. Yes. So this is like how look like the pap smear. Very easy. As you said, you are scared. So the patient will be like this in the lithotomy position. We have to put the speculum and we have to put the brush inside. We just take the swab test. It's not painful, it's just uncomfortableness. And we do only for the seconds. And the same way we have to do the same time we do the pap smear and HPV together. If TVS ultrasound is another part to do it. TVS means transvaginal ultrasound. When patient coming to us, so we do the pap smear, we do the transvaginal ultrasound to reassure the cervix is okay, there is no any abnormalities in the cervix. And then the other things for the colposcopy, if someone have a higher risk HPV positive and there is a changing in the pap smear, definitely we will go for the colposcopy. colposcopy is like is this first picture. We do with the camera. Camera will be high resolution camera, is outside in the cervix, and we put some medicine on the apply the cervical area, and then we have to check if there is any changing. We have to take the biopsy with a different way. So the treatment option, there is a surgery, as I said before, radiation therapy, chemotherapy, target drug therapy, immunotherapy. There is a different kind of the therapy available. It depends on the how much the cervix is involved. So HPV vaccine for the young children in the Europe and American, they make it HPV vaccine in the immunization chart because they take it like as a children, okay. But in our Gulf country, no, we don't have like as a child time, but we are trying to give our children in this age, the age is starting from the 9 to 14 or 15 years. But as an obstetrician, when I see the 9 years child, because now these days the girls, they are starting the puberty very early in the 9 years. So I ask the parents, just wait until they cross the puberty, like 2 years, 3 years, and the 13 years of the age, you can go ahead to give the vaccine. So this vaccine is not only for the women, they have for the boys as well. So if they are 15 years old or 14 years old boys or girls, they can go ahead with the vaccine. Only 2 doses. For example, 1 dose this month and the second dose after the 6 months. But for the adults, but for the adults, there is 3 doses, either male or female, both same. They have to take 1 vaccine like this month, second vaccine after the 2 months, and third vaccine after the 6 months. So this is the main the vaccine schedule we are giving the children and the adults. Thank you. Yes, any question please.